In 2020, 560 healthcare providers fell victim to ransomware attacks. The threat landscape is real and it's focused on healthcare. Currently today, there are 68 threat actors targeting US healthcare. And in 2020, as we all know, this landscape dramatically changed. As you know, security is a journey with a destination never achieved. You must adapt your programs, invest, continually train, test, validate, and exercise to combat today's threats. Next slide. Good afternoon and good morning. My name is Dave Bailey. I'm the Vice President of Healthcare Services for Synergistic. I've been around the company for 5 years and been intimately involved with the delivery of most of the services that Synergistic has to offer, and I'm pleased to provide an overview of our 2020 annual report and really look at how the industry fared against the NIST cybersecurity framework. Next slide. There are key security executive takeaways from this report. The first is about the ever-expanding cyber attack surface. In 2020, no one conducted their personal lives or their business lives the same with the impacts to the global pandemic. We saw an ever-changing attack surface as far as cybersecurity is concerned. We saw everyone move to a remote workforce. We saw the dramatic increase in telehealth. We saw change in what had to be connected into our environment in order to make that business and our personal lives successful. And we saw a tremendous attack on today's supply chain. Ransomware is a cyber weapon of choice. One of the main reasons that it's a cyber weapon of choice is that the threat actors, they turn their attention to healthcare. One of the primary reasons for that turning of attention was just the fact that other industries that they had focused on before were impacted by the pandemic. So we saw a major shift and a major targeting in 2020 to healthcare organizations specifically. Currently, right now, it looks that ransomware is reported at an average payout of $234,000 per event. What we are seeing is not only the ability for these ransomware attacks to be successful, but also profitable. And that's one of the main reasons for the change in the threat landscape. Healthcare is critical. It is considered critical infrastructure for the United States government. And what we also see is the fact that we're moving beyond the traditional data breach and moving beyond to where these types of attacks are affecting the entire ecosystem of care delivery. Next slide, please. What were the effects of COVID-19? Major business interruption. We all saw major business interruption. We saw delay in all types of standard services. Also, healthcare organizations can turn their attention to COVID-19 response. In addition, major impacts to staff. Staff had to adjust to a remote workforce, and the overall ability to protect and safeguard their patients, their businesses in this new way of conducting business. Next slide, please. What I'd like to talk about today is overall misconformance as reported in our 2021 annual report. There are a few key takeaways that really sets the stage to provide insights into how the healthcare industry fared for last year. The good news about this is 70 organizations performed in that 4-year period where we have data, more than one assessment. So from that standpoint, Synergistic has the ability to provide that trending. We have many clients that have multiple assessments that we do for. It enables us to provide trending information year over year. 64% of the organizations that we assessed So 64% of those organizations in 2020, from a misconformance perspective, received a conformance score below 80%. How we derive that conformance score is we look at each control in the NIST cybersecurity framework. There are 23 controls. We use the COBIT maturity rating system, and Synergistic views conformance as a 3 on that scale or higher. What does a 3 mean? A 3 means that you can demonstrate with that control that it has a process that achieves its purpose and it's well defined. So as we look at this information, we saw that we had a very large portion of the organizations that we assess fell below that passing grade. And with that, we wanted to look at what were those impacts, what were the trends and the themes to the high performers, and the trends and themes to the low performers. Go ahead, next slide. Some of the key takeaways that we have from a performance standpoint is 75% of the organizations that we assessed in 2020 showed improvements. However, a lot of those improvements still meant that they weren't meeting the grade. We did have organizations that showed decline from a maturity standpoint. Now, it always doesn't mean in decline that it's a sole reason or responsibility because IT security either didn't perform their job or there was an issue solely from a security perspective. Many of the reasons that we did see in 2020 that impacted conformance had to do with just the ever-changing landscape, the ever-changing business models, and the pressures and the stress that are on health systems today in order to survive. And we're going to go into that detail as we look at the breakout of the cybersecurity framework. The industry is progressing, but it's not progressing enough. And when we looked at the averages this year, we decided that we were going to break out those averages into high-performing categories and low-performing categories. One of the main drivers for that was if you looked at the overall number, you would see that the industry made slight improvement. But as you break that out, what you found was the high-performing group, in most cases, drew that average up. So what we wanted to do now is break out that basically by high performer, overall industry average, and low performer. I think it will give a good insight into the state of where healthcare is today. Next slide, please. At this time, I'd like to break out the main functional areas of the NIST cybersecurity framework. The first of those functional areas is identify. The primary purpose of identify is to make sure that an organization's security program, and as a business, you can identify all the things that you have to protect, to include all your assets, your people, your processes. Not only do you know what you have to protect, but do you have the ability to identify and manage risk? One of the things that we found a common theme in the identify functional area of the NIST cybersecurity framework is many organizations struggle with the lack of knowledge or control of all of the network connected devices. What we find is most organizations have control over assets that IT manage. As we expand out through the entire ecosystem of care delivery in an entire enterprise, what we find is there are many things and many different types of assets that do connect to the environment that don't have the same rigor or lack the management. This is that whole internet of connected things on the internet, the whole IoT experience, to include medical devices as well. The other area that we highlighted, and one of the areas that is a focus in the NIST version 1.1 of the cybersecurity framework, of which we use to evaluate organizations, was an emphasis on supply chain. And what we found, this is the worst area that we identified or assessed throughout 2020. And many organizations have informal practices or incomplete practices in their ability to manage business associate risk. Some of the pressures that we did see, not only around the ability to manage business associates, was also that change in the environment. Many organizations are consolidating, many organizations are acquiring, many organizations are being acquired. One of the things that we did highlight that was a theme throughout that was we had many organizations that have sound security practices, but their landscape is changing as well. And when those types of mergers and acquisitions and change in business landscape happens, in order to move those security practices effectively and make those practices mature throughout an environment is a challenge. And we did see that in many cases. So it is important to know that, when we look at and assess an organization, there are so many factors that are changing. And one of the things that is important to highlight is, as we talk about this journey of a security program, not only do we have to adapt to the forces that are a part of our organization, we have to adapt to this ever-changing threat landscape. Next slide, please. Next, I'd like to talk about the protect area of the NIST cybersecurity framework. The protect area covers, do you have the appropriate safeguards in place in order to protect your data and your business? Some of the primary themes that we identified is an incomplete use of multi-factor authentication. Many organizations do deploy multi-factor authentication. They do it from a remote access perspective, but still lack when it comes to privileged access and other general access to very critical information. And as what you see, based upon the difference between the high performers and the low performers, is there is a smaller group of organizations that are embracing that and are using multi-factor authentication, and others that still have opportunities to be able to expand their multi-factor environment. When we look at the threat and we look at what the threat actor is doing today, one of the main reasons that they can execute major destruction to your organization is once they gain a foothold, once they get into your organization, they will conduct credential harvesting, they will look for accounts, and they will compromise accounts. And once those things happen, they're able to identify critical assets, and they're able to cause the most damage they can, certainly when they execute ransomware. One of the key factors in limiting that capability is the use of multi-factor authentication. The key entrance and the way that most healthcare is getting impacted today, that threat vector, how does all of this start? How does the cyber incident start? A lion's share of how this starts is all with your workforce. It's all with some unintentional event that occurs. And one of the themes that we did see is there's still not enough role-based awareness training on today's threats. Everything that has occurred, and one of the major impacts to things like ransomware, have to do with folks opening up email attachments, clicking on links that they shouldn't click, or doing something that introduces the harm into the environment. It starts with that user, not only from a general user standpoint, but also your privileged users. It is important to provide the right training and the right level of awareness to a privileged user, knowing that the account that they use can cause damage if it is compromised. And we saw many organizations that did have issues. And when we looked at some of the major cyber attacks that occurred throughout, some of those attacks and some of those major incidents were because privileged users' credentials were compromised, and they were able to cause the maximum amount of damage. The other area in the protect realm was an incomplete use of security technologies. Many organizations are investing in those technologies. They use things like IDS. They are deploying SIMs. They're deploying EDR. We still see a lack of EDR in most cases, but they are moving their traditional endpoint protection products to EDR. And we see also a very limited use in enterprise DLP. A lot of organizations are starting those investments. They have those technologies available to them, but they are not mature. They are not automatically blocking. They do not cover all of the areas of data in motion and data at rest, or they don't have full visibility into their entire situational awareness that's required in order to determine whether they have a cyber incident. So it's really important for all organizations to make sure that as they invest in those products, are they maximizing those investments? Do they have full visibility? Do they have the ability to automatically block and protect the information that's required in order to safeguard sensitive information? Next slide. The next area of the NIST cybersecurity framework is detect. Do organizations have the ability to detect a cyber attack? One of the key areas in this is, do you have roles and responsibilities defined? Do you have the appropriate sourcing and resourcing in order to provide that full situational awareness and able to detect from a cybersecurity incident happening? What we see is many organizations, and the ones that were in the low performers, don't yet have full capability when it comes to that visibility. They also struggle with the difference between internal and external sourcing challenges when it comes to proper detection. Can you deploy third-party security operations center services that covers your environment 24/7? Does that environment allow for the appropriate view and response capability based upon the needs of your organization? Some organizations are attempting to use hybrid approaches where they try to have resources internally to do that, and knowing the amount of information that has to be digested, analyzed, it is very, very difficult to meet those needs. So we still see the industry struggling in some cases when it comes to being able to provide full accountability for detection roles and responsibilities, as well as just full visibility into their environment in order to be able to detect all types of cyber attacks. Next slide, please. The fourth area of the NIST cybersecurity framework is the respond function. One of the main drivers for response has to do with your ability. Can you respond in the appropriate amount of time? Do you have the resources? And can you enable your organization to make the right decisions to bring your organization to a successful closure that provides the least amount of impact to the organization? Can you operate under duress? Can you make the right decisions? And can you recover from that cyber incident? One of the main themes in this area as we assess organizations is most organizations do have incident response plans. Some of the primary issues that we identify in this area is those plans, some may be missing or they're incomplete. In other areas, they have plans, but those plans are not tested. They don't exercise those plans. They don't interact and engage the entire business, and they don't really know if they can survive from the types of attacks that the threat actors are actively engaging in today. The other area to point out, and discussions that we have had with many clients, is a reliance on cyber insurance as part of response. Cyber insurance is a major factor and a key tool in your toolbox in order to be able to appropriately respond to an event. However, if those services are used as part of the response, are those services available to you? Do you exercise those services? And are they capable of being able to assist you as you move through the whole duration of the event? And in a lot of cases, the cyber insurance does help post-event and help you manage the incident from that perspective. But from that first responder perspective, It is the ability to make sure, can you bring the right resources to bear in the event your organization is under attack and in duress. Most organizations don't maintain IR retainers. One of the things that was highlighted that we did notice in 2020, certainly around the threat that is occurring today, is that if you have a large-scale regional attack that affects this industry and you don't have an IR retainer, do you have the ability to get the appropriate resources? If your incident response plan says, if we need outside help, we'll contact outside help. It is important to make sure that if your response plan says that you do have the ability to utilize those sort of resources when you need it based upon an SLA that will help you out of that response. Ultimately, this comes down to having complete playbooks. Can you respond to a ransomware attack? Do you have those playbooks? Do you exercise them? Does your staff know about them? Do you include everyone outside of just the security and IT teams? And it's real important to know that that incident response plan can help you minimize the impact to a large-scale cyber event. Next slide. The last functional area that I'd like to talk about as far as it relates to the organizations that we assessed in 2020 is the recover function. One of the primary themes that we saw in this area for low performers is not all of their recovery plans included all of their IT systems. Most organizations have critical systems like their electronic medical record systems and like their key care delivery systems that they have the capabilities to recover from in the event that the system is impacted. What we do see, though, is overall lack of testing of entire infrastructure capabilities, the true awareness that, will your plan enable the business to recover in the event that those systems become unavailable. We all rely on outstanding failover technologies today. We have the ability to recover backups from snapshots and from highly available and highly effective systems. In the event those systems are not available to you in the event of an attack like ransomware, do you have the plans and processes in place that can bring the business back with the least amount of impact? And that just comes down to the ability to test those plans and ensure that those plans include all of your IT infrastructure and not just the critical systems that surround the care delivery platforms. And those were the key themes that we saw throughout the organizations that we assessed. And next slide. At this time, I'd like to introduce Andrew to you. And Andrew is our Director of Privacy, Compliance, and Managed Services. And Andrew will go over the annual report as it relates to privacy. Here's Andrew Mahler.
Great, thanks, Dave. And I see a number of familiar names in the attendee list. So welcome everybody who's here. Thank you for joining. Really happy to be talking with you today. So Dave, led us through some of the things that we've been seeing over the past year in the cybersecurity world. I want to take us into the data privacy world and really take a look at what is essentially a year in review. So if you can go to the next slide, please. More than 40% of organizations reported privacy has become more important in the wake of COVID-19. And I'll talk a little bit in this presentation about really what that means, but something to really consider, especially as organizations begin ramping back up and conducting business as usual, hopefully, in the next few months. Next slide, please. In 2018, healthcare data breaches of 500 or more records were being reported to OCR at a rate of about 1 per day. By December of 2020, that rate had doubled. So what does that mean? It means certainly there are larger breaches that are happening. There are potentially more large breaches that are happening. So these are breaches and incidents that involve 500 or more individuals. And maybe reporting has also become better. So just a few things to think about as we sort of walk our way through the privacy world in 2020 and maybe a little beyond. Next slide, please. So these are a few of the key takeaways from this session. I'm going to dive into these in more detail in just a minute, but this is this sort of 50,000-foot view as we look at data privacy and all of the things that are associated with data privacy, such as the privacy rights, as well as breach notification. Something that's really important to really be focused on this year and years forward is the state-by-state privacy legislation. It's really important, it's vital that organizations not only understand the state law requirements where the organization actually conducts or performs business, but also the residency of the individuals and the consumers and the patients that it serves. This is only going to become more complicated, more complex as more and more states begin enacting their own data protection, data privacy laws. Another key point here, as we've seen, I'm sure many of you have heard about or at least are familiar with GDPR, the General Data Protection Act, or CCPA in California. These are privacy laws and rules that have been kicking around for more than just a year. These have been, modified, remediated, very discussed over time, and jurisdictions, and this includes states as well as international jurisdictions, they really have a well-worn framework at this point to work with. We've already seen that CCPA's new iteration incorporates a lot of what we see in the GDPR privacy rule in the EU. We also saw a continued focus on individual rights, particularly from the Office for Civil Rights. There were 11 right of access settlements in 2020, and the penalties were not small. They ranged from $15,000 all the way up to $200,000. So we really saw OCR continue their focus on their right of access initiative as they're working to really make sure that patients and individuals are able to make the requests appropriately, receive timely access, and are charged reasonable fees. That said, don't lose sight of the other rights that are out there. I've put a few down, rights to amend records, accounting of disclosures, and so forth. Those are specific to HIPAA. Many others are found, either using the same word or similar words in other privacy rules and laws, both here in the US and abroad. Of course, we couldn't talk about 2020 without talking about how things have changed under COVID. We know that OCR has, continues its enforcement discretion and the waivers that have been in place really since the beginning of the pandemic last year. At some point, those will probably be withdrawn. We don't have any indication of when that will be or how soon, but it is important, especially as you're coming out of some of the stress, again, hopefully, of the pandemic. You're thinking about, okay, how are we going to continue to do the business that we've been doing under COVID, but do it in a way that we believe is compliant now that OCR has withdrawn its waivers and discretion. So really think about things like telework practices, telemedicine, things like that, as you're looking to really build up and really have a great compliance and privacy posture. We saw a continued focus on vendors and business associates. In 2020, about 50% of settlements involved some type of a business associate relationship or a business associate itself. And these penalties, like the individual right of access settlements, are not small. In fact, these are much, much larger. I believe the smallest one was $1 million in 2020 that involved a lacking business associate agreement and relationship, all the way up to $2.3 million. So we really see OCR continue their focus on vendors and business associates and focus on covered entities and how they are really managing appropriately those relationships. Next slide, please. Great, so now I'll dive a little bit deeper into some of the things that I mentioned earlier. Let's talk a bit about the enforcement discretion waiver. OCR made it very clear that they would begin to use enforcement discretion in their enforcement of HIPAA, and they would waive potential violations of the HIPAA rules as it relates to providers, covered entities, and others moving from providing face-to-face, in-person patient care, and now using telehealth communication. They've also issued waivers around community-based testing sites and so forth. So those entities and organizations that are providing vaccines to their community, or even doing different types of COVID testing, OCR and HHS, they have scaled back and said, we're going to use enforcement discretion, and we're going to waive potential penalties. Those have not been lifted as of today. There's no indication, again, of when they will be lifted. Only that at some point, either the interim secretary of OCR or director of OCR or the next director of OCR or HHS may withdraw. As I mentioned earlier, there were 11 right of access settlements. And I guess I'll just pause here for a minute. One thing that's really important when you think about these data privacy laws, we're not only thinking about the privacy of individuals or consumers or patients or their family members and so forth. We're also thinking about all of the privacy rights that an individual is guaranteed under that rule or law. So that's why you'll hear me talk a bit about the rights. You'll hear me talk a bit about how these play into the various rules and laws. And here in the US, again, we saw a very strong focus on the individual right of access. OCR has been very concerned for a number of years that patients have not been receiving access in a timely way. They've not had responses in a timely manner. The fees that they've been charged are not reasonable. And we have no indication that OCR is going to stop. So something here to think about, as we're looking at the year in review and how difficult and challenging 2020 was and 2021, even though there were enforcement discretions and waivers, OCR was extremely active in pursuing settlements, resolution agreements. I mean, there were 19 resolution agreements total, although there was one of those that involved 3 different breaches. So 19 total resolution agreements, very, very active last year, and we don't have any indication that they're going to be slowing down. Of course, we had some proposed modifications to the HIPAA privacy rule. OCR, HHS, they're very interested in making changes to the notice of privacy practices, uses and disclosures of PHI to social service agencies. I think that's very likely to end up in the final rule, as well as expansion of right of access, and really trying to bring patient access in line with things like the information blocking rule that many of you have probably been involved in implementing. HHS, OCR, they're really trying to make sure that those 2 rules, information blocking and the privacy rule, don't run afoul of each other and create additional complex burdens. And then finally, we finally had the reports from OCR's phase 2 audits. They were released at the very end of last year. And of course, these audits are from 2016, 2017. Many of you may have been fortunate enough to have participated in those audits, hopefully not too many of you. But that report is very helpful as you're thinking about really your compliance posture, your privacy posture moving forward. I really encourage you to read that. Let's take a look at state data privacy law. So we've looked at the OCR federal privacy law. Now let's shift to state data privacy laws. So again, many of you have probably heard of CCPA, the California Consumer Protection Act, that provides data protection, privacy, as well as privacy rights to individuals living within California or residents of California. We saw that enacted in early 2020. And very early on, there were a number of class action settlements. Those were all resolved, those were all settled. But it's still important to remember, as soon as that was released, as soon as the private right of action was available, we saw a number of class action settlements against various businesses and entities in California that are subject to CCPA. Then at the end of the year in November, we saw the state residents went out to vote on new legislation to add additional teeth to CCPA, and so now we have something new. We have a new iteration of CCPA called CPRA, and CPRA does a number of things. It establishes the first privacy protection agency in the US, and this is going to be responsible for overseeing and administering any kind of fines or penalties. Introduces a lot of consumer rights and modifications to CCPA. So, keep your eye out for that. That's going to be enacted in 2023. You've got a lot of time to think about it and prepare. Of course, looking forward or looking almost to present day, we know now that Colorado and Virginia were hotly debating state data privacy laws in their own states. We've seen those enacted. I think it's very reasonable to assume many others will follow suit this year and in years to follow. You have to really keep in mind we have a little over half of the states in the US are considering or they're kicking around privacy legislation in their own state. So, these rules and laws are only going to continue to percolate up. And then we had a number of modifications to breach notification laws throughout the U.S. So lots of changing of definitions, modifying what personal information is, modifying notification requirements. So again, I hope many of you have been involved in some of those discussions internally. If not, reach out to your general counsel, your privacy officer, your security officer, your compliance officer if you have questions about whether or not there are certain state laws that may apply to you. And then finally, federal and international data privacy laws. We continue to see discussions at our federal level, although it doesn't look like those are going anywhere anytime soon. These discussions have been really revolved around this idea that we may need some type of a federal data privacy law that so that we don't have this patchwork of 50 or so states that have their own data privacy laws. But again, those conversations continued to come up last year, continue to not go anywhere, as is happening right now. We also saw the invalidation of the EU and the US Privacy Shield framework. In this case, the EU court found that this Privacy Shield framework, it no longer provides a valid basis for data transfers from the EU to the US. Left a lot of things up in the air around certain contractual agreements and clauses related to how data is moved between the EU and the US. Again, if you have consumers, patients, clients, et cetera, living in the EU, you have questions about whether or not GDPR or others may apply, please take the time to dig into that and confirm that your office, your compliance posture is really where it needs to be. And then finally, we saw a couple countries really talking very seriously about data privacy laws. Brazil's they passed their general data protection law that became effective in 2020, and last year China unveiled a draft personal data protection law, which should be something that really impacts many organizations that are doing business with China. Next slide, please. So now I'd like to shift gears a bit and talk about what we're seeing within organizations across the country. We find a number of challenges. I'll talk first about the challenges, and then we'll dive into some of the really good things that we've seen happen over the past year. These challenges are the ones that come up most often. They didn't only come up last year, but many of them continued to come up last year in 2020. So these are some things to, really from a privacy perspective, keep your focus on. No or limited user access monitoring and auditing. So, are you using a tool? Are you doing something beyond reactive monitoring? What are you doing to maintain that effective user access monitoring program? We still see a number of defective HIPAA authorizations, defective authorization policies and procedures. Really important that you're ensuring that both the authorization template you're using and the policy you're using describes the core elements and the required statements that the privacy rule sets forth. The authorization, as many of you know, this is really the primary vehicle by which you can use or disclose somebody's PHI. And it's very important that you're following all of the standards and implementation specifications of that standard when you're asking a patient, can we use or disclose your PHI for a certain purpose? Continue to see violations of the minimum necessary rule. Very important that an organization defines criteria that limits the PHI disclosed, and that they're requesting only the amount necessary to achieve a certain purpose of the disclosure. And this is a great, area where we frequently see privacy offices and security offices working together to build systems, processes, some of them automated, to make sure that any of the PHI that they're using or disclosing is really the minimum necessary amount that's required. Again, we see some insufficient policies and procedures. Very important from a privacy rule perspective, security rule perspective, and breach notification rule perspective, that you have policies and practices that are updated, so they're reviewed by somebody or by a committee, and that there is appropriate language in all of your policies and procedures. This is really your first line of defense if a regulator knocks on your door, whether it's OCR, the Attorney General, or anybody else. One of the first things they'll ask for is your policies and your procedures. So this is something that is very important that organizations have, and that they not only have and they not only make available to their workforce, but they also train their workforce on those policies and procedures. And then finally, and this is a fun, complicated one, there either is no or it's an inappropriate hybrid entity designation. So there are a number of organizations and entities across the U.S. that perform functions that may involve some type of PHI, and then they have functions that are firewalled off completely from any of that PHI use or disclosure. So if you think about universities and academic medical centers, for example, various community health departments, those sorts of entities, it's very important from a risk perspective, and again, not just privacy, but also security, that your organization really understands what kind of entity it is so that it can appropriately manage risk. Okay, next slide, please. Great. So now we'll jump to some of the positive things that we saw happen across 2020. Again, there were a lot of challenges, a lot of things that were very difficult for so many organizations across the country. And we still saw improvements. We saw, in many cases, a compliance improvement of, in some cases, 45% all the way up to 85%. And you might say, well, what did they do differently between 2019 and 2020, or 2020 and 2021? We're seeing really general improvements to their existing policy, or a creation of new policies or practices that are required. A couple of key examples. I mentioned the HIPAA authorization piece earlier. We're seeing organizations really get a handle on their authorization policies and practices, especially in the human subjects research context and in other areas. We're seeing organizations actually perform some auditing of authorizations to make sure that, when they are obtaining or they're asking a patient to use or disclose data, that authorization meets all the requirements. OCR has a tendency to ask for examples and samples of authorizations if they're investigating or they're auditing an entity. So again, all the more reason to make sure that those policies and practices are effective. Remediating issues related to the notice of privacy practices. So we're seeing the postings being better, better visible and in appropriate spaces within the organization. We're seeing that the notice of privacy practices itself is actually more compliant, as well as the policies. And then finally, breach notification policies. Unfortunately, we've still seen organizations that have not adjusted to implement concepts that were effective as part of the high-tech or the final omnibus rule in 2013. And part of that rule were some significant modifications to the breach notification rule and the way that incidents are assessed. So while we've still seen organizations struggle to implement some of this language, we saw some significant improvement over the past year as they really got some of these concepts under control. And then finally, addressing gaps in user access monitoring programs. We've seen many organizations move to using a tool to perform user access monitoring. We've seen organizations use tools to perform things other than reactive monitoring. So they're not just looking back when there's been an issue or an event, but they're actually doing it in real time, or they're doing it in a forward-thinking process. So they're really looking to confirm, okay, are the are our users or our workforce interacting with patients and their records in a way that's appropriate and permitted. Next slide, please. And with that, I think it's a perfect opportunity to dive in. I'll spend the last 2 slides just briefly talking about what we're seeing on the user access monitoring side of the house. We're seeing organizations, they're using a variety of monitoring tools. So as many of you know, there's not just one tool out there. There are many tools that exist. When I started doing this 10 years ago, there weren't so many tools, and now there are many options to choose from. We're seeing organizations shop around, look for the right fit for a tool, and we're also seeing organizations being a bit more thoughtful and intentional about the different report types they're looking at. And what do I mean by report types? You can see on this pie chart here, and hopefully you can see, I don't know if the text is too small, but you can see in the legend there's a number of different report types. We've tried to highlight some of the ones that we see most often. So things like coworker snooping, neighbors snooping, snooping into some VIP's records. So if you have a celebrity or a politician in the hospital, those can be marked as a VIP or a confidential record. And we're seeing organizations get more and more results and hits when they do that type of monitoring, where really they're looking at not just 1 or 2 different reports, but they're looking at the full gamut, or at least they're taking a risk-based approach and looking at as many as they can. We're seeing, over 75% of the cases, at least we're seeing, can usually be reviewed prior to delivery to the privacy office. So what does that mean? Well, there are a number of tools, like I mentioned, and these tools are fantastic. They are great assets to organizations, but they are tools, and a lot of them use artificial intelligence, other types of technology to try to take some of the legwork out of identifying an incident or an issue. That said, we're still seeing false positives come through. We're still seeing user-patient interactions that can be easily resolved either by looking at a policy or quickly examining a workflow prior to even a privacy office seeing that and having to take action. The highest rate of applied sanctions in 2020 involved same household, user self-access, and same last names. So you're seeing a lot of sanctions involving family members, folks living inside the house, as well as individuals accessing their own record. And then finally, and this ties back to the first bullet point, we're seeing some really creative approaches to user access monitoring because of COVID-19. So I'll give one example. One organization decided that they wouldn't only monitor or audit those cases where a patient had been diagnosed as a COVID-19 patient and people accessing their record. They took that a step further, and they said, we actually want to look at anybody who's been admitted with COVID symptoms. So even if they've been discharged with a negative result, we still want to look at everybody who's been admitted with a symptom of COVID-19. And they were, through that process, through that sort of creative thought and creative approach, they were able to identify some issues and perform some remediation. Next slide, please. And then finally, just wrapping up this privacy piece and touching back on user access monitoring, there's some examples here of different unauthorized access events, and you can see the percentages that we were seeing in 2020. Again, we saw a number in same household, coworker, neighbor, user self-access. Something that I just kind of want to leave you with today. As we looked back and our team looked at approximately 100,000 or more interactions between a patient and a workforce member, at least in one case, we were able to identify a significant number of users who had accessed their own record. Some organizations have policies and procedures that restrict that, or they prohibit a user from accessing their own record. Some organizations do not prohibit it, and some organizations don't have any policy that helps a workforce member or staff understand whether they can or they can't, and why not. So I just want to leave you with that note to think about your own policy. Can users access their own record? If they can't, are we monitoring for it? And if we're monitoring, what investigation, what steps are we taking to apply consistent sanctions if that's something prohibited? So with that, I think we can conclude at least this part of the privacy piece. And next slide, please. And we'll move into action drives change. Next slide. And I'm going to kick it over to Dave in just a minute, but this is again some of the high level items and issues that we see that we want to leave you with as you start thinking about this presentation and taking next steps in your organization. Dave?
Andrew, thanks so much for that update. And we just would like to leave you with, before we enter into a Q&A and an interactive session, which we hope you all participate in, what are the key takeaways that we can glean from, I think, the overall state of the industry, and what can help you improve your programs, minimize that risk exposure, and be able to help address the threats. We've categorized those things in a few things. Anything that you can automate today, what are things that can help you improve that security posture? Automating functions like user access, monitoring, and auditing, those things can certainly help you, knowing the volume of types of interactions that occur and the behaviors that occur. And more importantly, to know that today's threat actor, they want your accounts, they want to harvest those accounts, and they want to use those accounts in order to do harm to the organization. So not only do you need to satisfy those requirements to ensure that you're protecting the patient information, you also want to make sure that you're safeguarding those accesses so they cannot be used against the organization by a threat actor. Asset discovery is key. You cannot protect what you don't know about. There are too many things that are connected to the wire, and there are too many things that right now organizations, they have good control over the things that they do manage, the knowns, but there are too many unknowns, and there are too many things that are still connected to the network, and you want to have that ability to be able to make sure you can identify everything that you have to protect. Compliance reporting, and what I mean by that is, do you have the ability and can you implement the ability to make sure things are patched appropriately? Can you report on that? Can you look and ensure all your data protections are in place and operational? Are the things that you expect to be encrypted? Is that endpoint protection up to date? Do you have the right safeguards, and can you report on that? If you can automate those functions and you can help where you do not have to do manual checks, you will put yourself and your organization in the best posture that you possibly can. With that, that leads in the ability to do continuous monitoring. Do you have the ability to have full situational awareness to be able to detect and respond? And what response actions can you do automatically? The more you have to include human interaction into addressing today's cyber threat, the more potential there are for impacts to the organization that may be harmful to the organization. So anything that you can do, not only from continual monitoring, but as well as automatic response to ensure that the appropriate safeguard was implemented or in place, is really, really important. It can help address today's threat and also can help you improve your overall security and risk posture. It is really important as we move into 2021 and the end of 2021 and 2022 is to ensure that we're able to validate. Validation is a key term that Synergistic will talk about moving forward, because in order to really demonstrate that you can address today's threats and address today's needs is to validate the effectiveness of your controls and your people, your process, and your technology. So there are certain things out there that can certainly help you from a privacy perspective to understand, what is that landscape from the regulatory side. It is always important. It's the foundation of everything to continually assess. You need to continually assess the state of your organization, where you are, and then ensure that you can overlay the threat and understand the risk that's associated with those threats. In order to ensure that you can successfully navigate and put your organization in the least amount of impact, is to make sure that you can validate the effectiveness of controls. And that moves beyond the assessment into, truly running inoculated attacks, truly exercising, rehearsing, and planning. As we move into that next bullet, you cannot rehearse or test your incident response plans and capabilities enough. You do have to continue to continually exercise and plan and make sure that not only when you exercise, are you covering all of the regulated data and all of the sensitive information that the organization has to safeguard and maintain, include the business leaders, include the folks that will have to make decisions beyond security and IT. Traditionally, it's always been a system is down and the business waits for the system to come back up. In these types of cyber attacks, you may not know when that system is going to come back up. You may not trust the data, and you may have to make decisions that you've never had to make before because of the type of cyber attack that is being conducted. So you cannot rehearse, test, or validate those plans enough. And it is important to make sure from the privacy perspective that those right of access requests are rehearsed and tested, so you can address those as they impact the organization. Go ahead, next slide. The last two things, cannot say enough about looking and making sure that you can adequately address supply chain and supply chain risk. Part of the key factors to this is ensuring that your organization has defined risk tolerance. What are the risks that you need to evaluate? What's important to you from a risk perspective? And can you evaluate that vendor to ensure what those risks are? And what is your tolerance to the organization in order to determine whether you're going to enter into a relationship or in some fact, end a relationship based upon the risk that's identified as part of that evaluation.
I'll just jump in. Yeah, and thanks, Dave. And something I just want to touch on, I think that this has been discussed throughout the presentation. It's important to start looking beyond regulatory requirements. As you know, in many of your states, they're talking about data privacy, breach notification, modifications, and so forth in your state capital, at your state legislature. Very important that you're tracking that and following it in addition to any type of international law or other states where you're doing a lot of business or treating patients from those states. And as you're wrapping your mind around, okay, what rules and regulations apply to us, what you might find if you're a large enough organization is you may find that there are actually many privacy and breach notification laws that apply to your organization. Many of them may have some overlap. Many of them may defer to one privacy rule or policy over another, or law over another, but it can be very complicated. So important to start thinking about, are there consequences for consumer or patient privacy and security beyond what's currently required, and can we think about things down the road? And one way that we can do this is organizations that develop a data governance model, where they're looking at data across the organization. They're not just pinpointing the PHI or the FERPA data or other data that's regulated. They're looking at data across the organization. So all different types of data that they're maintaining, transmitting, storing, receiving. And they're asking the question, do we need this data? Do we need all the data to do business? And if we don't need all the data, are there things we can do to minimize risk by not collecting that data or not receiving it? So many things that organizations can do to help, to help sort of offset any future potential issues as new privacy laws and rules, continue to be modified or enacted.
And the last thing that I'd like to leave you with, next slide, is I do want to talk about resilience validation as we look to the future, as we look at how Synergistic can partner and can assist in the journey of privacy and security. We have traditionally over our years looked at this multi-year journey from the standpoint of our Compliance Assist Partner Program. We're modifying that and adapting that program to really address resilience validation. we want to make sure that as you're on this journey, not only can we assist you with the important things like assess, build, and manage your programs, we want to be able to also help you validate. And validation comes to, once again, to make sure that you can effectively address today's threats. You have trust in and assurance in the ability that the safeguards that you have placed will be effective in the event of that large-scale attack, or where you have to address those privacy and compliance concerns as they relate to any type of incident. So with that said, I really want to thank you for the opportunity today. We do have a question and answer session that is planned. This is an interactive session. Andrew and I look forward to the opportunity to be able to interact with you. It is an open discussion. There's opportunity for everyone to ask questions, and we look forward to that interaction. And once again, want to thank you for the opportunity today. And I'm going to turn it back over to Carrie.
Great. Thanks, Dave and Andrew. Really appreciate that. Hope everybody enjoyed the session. Before we move into our collaborative session, where you'll have the opportunity to interact with your peers, ask questions, do some discussion groups and topics. We do have one question that's come in. You can ask the questions in the Q&A section now, or you can also ask these in the collaborative section. But the question that did come in is from Christopher Leroy, and he says, looking at 2020 HIPAA privacy program results and considering the COVID epidemic, is this a considered factor to the improvement in using patient health information? And second part of that question is, how does 2019 compare against 2019 before COVID?
Really, really good question. So a couple things to think about, and I hope this answers your question, or at least gets to part of it. The privacy rule and the breach notification rule are a little different from the security rule, in that there are not opportunities to voluntarily comply with aspects. The privacy rule, breach notification rule, if you are a covered entity, or if you're a business associate that is performing certain types of certain types of functions, you have to comply with the entirety of the privacy rule. So all of the individual rights, all of the uses and disclosures of PHI, as well as reporting, incidents that you determine to be breaches. So for a long time, we've seen organizations, come into a better posture from a data privacy position over the past couple years. I will say that in spite of COVID and in spite of all of the hardships last year and this year, we have seen organizations start to look at things like a data governance model. They've started to look at adapting and modifying policies and procedures that don't only apply to regulated data, but apply to all of the data that they're maintaining or transmitting, receiving, et cetera. So we are seeing some significant improvements in spite of COVID. We've always seen improvements throughout the years, but I would say that this has been an encouraging year in that way. And I'll just say one other note. My background, so I was a lawyer and investigator for the Office for Civil Rights. I've been a privacy officer. I've been a research compliance officer. I've dealt with OCR and dealt with regulatory agencies in a number of different ways and a number of different spaces. And they were incredibly active last year. The attorneys general were not as active last year, enforcing various privacy breach notification laws, but OCR was. OCR was very, very active. And my guess is that because a lot of the investigators and lawyers were working from home and maybe had some more time to, crank out some resolution agreements and closure letters that maybe they had been sitting on for some time. So they were very active in announcing resolution agreements and settlements. And I think that did cause people to think, okay, even though these resolution agreements and settlements involved violations that may have occurred several years ago, I can really get a sense of the things that are important to the Office for Civil Rights and things that we need to start doing proactively, things that we need to elevate beyond just our offices and to boards, committees, to senior leadership to help them understand. These are things that there are things we need to start doing to make sure that we're not, in the news on the list next time.
Okay, great. Well, there aren't any other questions at this time, so we're going to move into our collaborative session. And if you can move to the next slide, please. There are a list of topics that we can discuss, but really this session is going to be led by you. This is an opportunity for you to ask questions, to share best practices, and really amongst everybody here on the line. And so to do that, we have a max number of people that can be on camera at one time. That's 16 people. So when you do want to join the discussion, I ask you to unmute your microphone and then turn on your camera. If we see that your camera's on, that means that you're, we're expecting that you're going to be engaged in the conversation. And I'm going to turn it over to Dave and to Andrew to start the conversation. Also, at the same time, I'm going to be monitoring the Q&A, and if there are any questions that come in that maybe you don't feel comfortable asking yourself, I will bring those up as we start. So, guys, Andrew, I'll hand it off to you.
Thanks, Carrie. So, as we're waiting for everybody to, to start thinking about, these questions and think about things that are important to them, Dave, I'll start with you, and I'll put you on the spot. How do you effectively, or how have you in the past effectively managed your supply chain and vendor risks? And as part of that, maybe think about the next question, which is, what happens if you find the risk is too great, or you find that the vendor has done something that's unacceptable to you or to your policy, or there's been a violation?
Yeah, no, Andrew, thanks. And once again, everyone, I look forward to others' input. It is a pleasure to be able to look out across all the organizations that we have an opportunity to partner with and see some very good practices that are in place, and certainly understand the challenges that are presented. What we generally see is that the challenge is the fact of the amount of vendors that have to be assessed and the ability to assess them. And normally those assessments turn into attestation type assessments, and they turn into a resource issue when it comes to truly collecting the right information, ultimately to make a business decision. And I think what's important in assisting in this and helping mature programs is really determining what your risk tolerance is. And while you have a lengthy number of vendors that have to be assessed, it's being able to look at them from a risk standpoint and understand those vendors that are storing, processing, and have your sensitive information, have your PHI, have other information that is critical and important to your business. What are the factors that you need to capture from them to truly make a decision whether you will do business? Now, we have seen some outstanding practices that have been put in place in organizations. And when you look at those practices, things like technical security review boards prior to procurement, and IT and security teams and business leaders coming together to identify new requirements and being able to look at those requirements. Those are the types of practices that I think are very important if you are able to prioritize your vendors based upon risk and come up with what that risk tolerance is. What are the things that are going to flag that vendor or that process to be able to say, hey, if here's a minimum requirement for our organization, it doesn't meet this minimum requirement, how is that business decision made? Is security able to influence that? Is there a process at which the business owner understands what that risk is, and can they accept that risk? And those are areas I think that there's still opportunities there in a lot of organizations to mature that. Not to say that others, some organizations don't have that practice in place, but it is important to the process to evaluate a vendor from a security perspective is to be a business enabler. You have to get the right information in order to address your risk tolerance. So what are the things that you need to do to understand, will that vendor be adequate to safeguard your information? So I'd love to hear from someone else and provide input into that. There's many different avenues that we go down when it comes to business associate and vendor, risk, and would love to hear from someone else if they'd be happy to chime in.
And to join the conversation, you don't necessarily have to turn on your video. You can just unmute yourself and ask the question or join in.
Hey, Jay.
I'm not sure if that worked. Okay, here I am. Yeah, so I think you hit the nail on the head. I think volume is a huge challenge. And generally speaking, we don't have too many IT staff, right? So we're already pretty tight on that. And doing a real good review, a thorough review, a meaningful review, takes a lot of time and commitment from committed resources. So I know there's varying numbers of people in terms of team size. So that's always a challenge. Trying to design a process that effectively plugs you into the business process, right? There's a lot of times, especially very large organizations, where different entities might operate slightly differently. They bring in vendors, engage vendors slightly differently. And sometimes by the time IT gets involved, we're a little bit late to the party. There could be contracts already signed. There could be data already flowing. So one of the biggest things that we've seen designing the process is really around starting with understanding all the inputs, all the places that vendors could get engaged from, finding all those different places and kind of centralizing that. It's easier said than done, but that's an important first step, because no matter how good you make the process for the ones you know about, as long as there's ways to circumvent the process, people will take advantage of that for what they feel are the right reasons, right? They're trying to get the business moving. They're trying to accomplish their goals. So I would say consistency, biggest challenge. And the answer to that, at least from my perspective, is to really get a lot of knowledge about the operating structure of how things work. How can someone engage a vendor that involves data, and really understanding that at the different areas of the business, and then working with leadership around helping them understand why it's so important to centralize. And you eventually kind of drive towards that, lay out some processes. And one of the good things we have is a choke point. Whenever I'm designing a process, look for that bottleneck. And generally speaking, most of us are in IT, and the way the world works now, right? They're going to need firewall rules. There's going to be some connection point with IT. So to educate and get those teams engaged, to use each time those come in out of band as learning processes to help you capture some of those outstanding areas maybe you didn't know we're implementing new solutions, right? So someone puts out a firewall request to open up access to ABC cloudstorage.com, and diving into that and having the right alerts kind of go off to let you know that there might be a business partner situation going on there has been very helpful. So those are some of the things we've done. We certainly are growing. It's certainly a journey. But I think for a lot of people in the audience who are trying to get started, that was one of the things that really helped try to address the vendor risk side of things.
Yeah, no, Daniel, thanks so much for the contribution, and you hit some key points there. And I just use the term loosely, the whole shadow IT.
Yeah.
That comes about, the whole legacy component of, hey, the process works great for the new things, but there's so many things still connected to the environment that they haven't gone through that rigor. And I think those are the challenges. I would just ask anyone if they are at a starting point, at least develop and design a process around risk. Determine what you consider to be your most high risk vendors and assets that you need to protect, and then build that process around that, and look to ways to automate those processes. Look to ways to if staffing is an issue, to outsource those capabilities if appropriate, and once again, prioritize by risk, because there's just no way you can't boil that ocean. There's too many.
Yeah, and even to draw a scope on that, I'll draw it in a little bit on that. You're 100% right in terms of trying to shrink that ocean you're trying to boil. And in the current risk landscape we're facing, really, ransomware, right, jumps to the top of the pile. So really leveraging any of the other work that you might have done, even across some other teams in the BCP, business continuity management space, to try to understand, where are your IT systems that involve the most critical business operating, roles, and making sure you start there with that vendor risk management, just to get your hands around things that can literally, knock out the business, right? So.
Hey, Brett, how are you doing today?
Good, thanks. Thanks for the discussion. I have a couple comments and I guess a question. So I've previously worked as a consultant and on a number of different clients. I saw various vendor risk management programs, and then when I came to industry, I was shocked by the difference that I saw in my own organization, and that's around the collection of evidence. So in some organizations, they want to see evidence of every response to a question, right? If you do incident response, I want to see your incident response plan. I want to see your policies. Some organizations say, I don't want to see that kind of evidence because I don't want to have to interpret it. You attest to what, you're attesting to what you do, and that's good enough for me. You're bound by that. If you say that you do that, great. And obviously there's a vast difference in the amount of time it takes to do one versus the other assessment. I want to get your thoughts on what might be a preference. Obviously one has the benefit of maybe making sure that we can trust what they're saying, but the other being we don't have to interpret their policies and procedures.
It is an excellent question, and I'm going to answer it in a starting point and then where I think there's a balance. There's the ideal, there's the perfect world, and there's the balance. The attestation component, I think, is the minimum. What we see and what we've seen over the last few years is, vendors now are understanding, and it's in some cases, kicking and screaming, that there's requirements that now they have to address that they didn't have to address before. Oh, I have to answer this questionnaire that the healthcare, hospital or provider sent to me. What we're finding now is we're seeing a major shift in that. Not only are they having to answer the question once, but their organization is realizing that everyone wants to be able to understand the risk posture and make a risk decision, based upon, that level of attestation. I can speak for the organizations that we help and support. There is a balance. If there is documentation that is required in order for the risk determination to be made, we collect that information and we review it. What we generally see are things more at a more focused level, things like SOC 2 reports, things like the incident response plans, the policies and procedures. Some organizations will review that as part of their risk review process. Others will look to a vendor to be able to digest that information and ultimately come up with a risk determination. I think personally, I'm going to speak for me. This is just what my desire as a cybersecurity professional and someone who's invested in this particular business. I think ultimately it comes down to the vendors need to understand that organizations need to make a risk decision. They need to do a better job at demonstrating that they have the ability to safeguard information. And I think as you see these processes mature and develop, and vendors get more acceptable to these types of requests, that health systems will actually be able to ask the right information and get the right information without having issues with contractual language, without basically saying, yeah, sorry, we don't do it, and yeah, you don't really have the ability to swap out a major vendor or player that you have. So I think ultimately it's a balance, and I'm going to go back to my original answer that say, manage that based upon risk. So if that particular vendor, it requires you to understand that they have an adequate incident response plan because they manage all of your data, then I would say it's highly acceptable to make sure that what is it going to take for you as an organization to feel comfortable and accept that risk? And if it's reviewing the plan, then I say review the plan. If it's, I can accept that risk if they just tell me they have it, then, that's okay based upon that risk tolerance. And everything comes down to that risk tolerance. So.
Thanks.
Yeah, I couldn't agree more. I was trying to get to that the last part he said there. We do a mix, right? And there's a big part of that, right? So if I asked you today, you know, do you have fire extinguishers? And you said yes, right? You have to think about what happens if they're lying, right? So if they say yes, and then what are you solving? You're solving an indemnification issue contractually because they said on paper, you have contracts, you got it. As long as that company's solvent and can actually indemnify you for the risks they're exposing you to, they might just go bankrupt if they can't actually pay you back. Maybe they have more risk exposure for your organization than they could even indemnify you for. So important to understand some of those differences of whether you're going to accept just their word for it. And back to the fire extinguisher example, if I have a situation where if they lie, the risk exposure is tremendous, right? So you tell me you're in my data center and you're telling me you have a fire extinguisher, but I don't validate that, right? I accept it because I feel that I'm going to be indemnified if you don't. But what about the impact when it happens, right? So if my data center catches on fire and I have a major outage and I have a major problem because I didn't validate that that was there, that's probably not risk the organization will want to take on. So it's really saying what Dave was saying around understanding. If you're going to do that delineation, then you have to have a deep understanding of the risk that the company exposes to you in their relationship with you. In general, we try to do both. We have an information technology security agreement, and what we often will do is we've tied that contractually to the GRC assessment. So if you tell a falsehood in the GRC, back and forth, you have a material breach of contract. So that helps us out with that side of it. But we also do, during the GRC review, we also do the actual assessments. We get those SOC 2s, we get those things, and we dig through them. And there is some interpretation and some work that goes into that for sure. And maybe I can find a better balance of when we're spending too much investment on some of those things. I don't know for sure. That's a hard thing to determine. But you definitely need to have situations that you do both. Or if you're gonna say, basically, would you buy a home without a home inspection? That's kind of what you're saying. I mean, you're saying that you're willing to take that risk without actual inspection because of the risk you're dealing with, or whether or not you're going to need to be a little more confident that what they're saying isn't going to result in an outage.
Yeah. Thanks a lot, Daniel.
Thanks. Good point.
Dave, another question came in from Kevin Mazone. It says, will the suggestions made here be part of the CAP program or our new resilience validation and biomed device assessments?
Yeah, no, that is an excellent question. When we do an assessment, and if we were to find those particular gaps, we most certainly want to make sure that the recommendation that we make to you fits for your organization and is specific to your organization. So yeah, we recognize that and are looking as we look into 2021 and identify and learn from what we learned from last year's assessments. We want to make sure that we're providing the right recommendation that can address the risk that's associated with that gap. So.
Yeah, and I think just to add to that too, we talk about the evolution of rules and laws and requirements and those things over time. And as we're tracking those, we're helping our clients evolve as well. So, I think that's important to know is that, as we see not only the requirements, but also best practices, and we can see, where things are headed, then we can make some adjustments and changes to make sure that we're evolving to meet our clients' needs.
Yeah, and I think I'd like to add to that and ask everyone as part of, if you are currently on this call and have had assessments from Synergistic or plan to have assessments with Synergistic, the importance of the workshop. It is important for us to interact continually throughout the process. We really want to make sure that not only is the information that we are gathering, collecting, analyzing, and ultimately determining risk and or determining gap or vulnerability, we want to make sure that it's accurate, and we want to make sure that the recommendations that we are providing to you are meaningful, And it's the playbook for you to be able to, build those next steps, build that action plan, enable the business, enable you to look at, the types of things that are required in order for you to improve the program and ultimately minimize risk. And I can't stress that enough, that this all is about risk mitigation. It is important to understand that there is not enough time, money, and resources in order to address all your risk. And with that, you have to be able to tell your risk story. You have to be able to prioritize based upon risk. And ultimately, in the event that you did have an adverse effect from a cybersecurity incident, today, right now, knock on wood, the major impact to that is generally financial. I mean, that's where it comes down to. It's either major business disruption, major reputational impact, or major financial, issue. I hope we don't get to where that financial burden changes over to life safety or for patient safety. We certainly will have those issues when IT systems are impacted, or heaven forbid any type of these attacks actually change data, which is, those, I think anybody's worst fear is to know that, a threat actor would actually use a care delivery mechanism in order to impact a patient. And whether they do it intentionally or unintentionally, I think that is the absolute worst scenario when it comes to all of the internet connected things that occur. So I just want to add that. I know that's long-winded. My apologies for that, but I think it is important to know that, as the threat evolves, as we evolve, we want to make sure, as part of our process, that we're working with you from an overall recommendation standpoint. So I would, just challenge everyone to challenge us and make sure that the information that we're providing back to you is meaningful. And that's really what the workshop is for. So appreciate that question.
Great, thanks, Dave. And Kevin had sorry, Andrew, did you have something to add? Okay, Kevin had a follow-on question. 2 parts here. What type of information should we review in the vendor risk management process as a result of the annual report? And what risk rating does CTEK recommend for the associated risks?
Ooh, this is a good question. I will say that I'm going to tackle the first part, what type of information. I will say there's always a good starting point if you have not yet designed what your risk tolerance is. And that starting point is always around, the framework that you are dealing with. We would employ and tell folks to, base their questions to ensure that, is it NIST-based? Can you make a decision? Can you ensure that the vendor you're dealing with, has a control over their people, processes, and technologies? Are they able to protect and safeguard your data? Can they respond to can they detect a cyber incident? Can they respond to it? And in the event that they had an adverse effect, is your data safe? Can they recover the data? So I would always employ anyone to start with a question that, or a questionnaire or a risk assessment process that is NIST-based. I will tell you, it is amazing to know that if you bring 20 people into a room and ask them what should we ask a vendor, you would probably get 25 different questions, or maybe even 30 different questionnaires based upon different options in varying degrees. And I would love there to be a standard out there, but generally speaking, I think it's really, really important when you want to answer that question to answer it based upon what's your risk tolerance. And a lot of that is going to come down to the type of data that they are processing. Is it a vendor where you're physically giving the data to? That data doesn't reside inside your environment anymore. It resides within the vendor's environment. And then I would ask you, what do you need to know in order to make sure you can adequately accept risk from that vendor in order to do it? So those are things like policies and procedures and security, security officers and roles and responsibilities, and the ability to make sure they have a good incident response plan, and what do they do with the data? How is it protected? Is it encrypted? Those types of things. So start your questionnaire around the functional areas of the CSF, and you'll not only be in the ballpark, you'll be playing ball if you do that, and then you can adjust and adapt from there. So. And I'm sorry, can you just say the second part of the question again? Because as I was talking, I realized I may not know what it is.
Sure. And what risk rating does CTEK recommend for the associated risks?
If CTEK was asked to make a recommendation to your organization, the first question that I would ask is what that risk tolerance is. I think there's some easy ones. I think there are easy risk determinations that doesn't really need a lot of consultative work or understanding of your organization. That truly is around the safeguard protections for the data. These are the standard things like, if they're offshoring, what do you do? That would elevate risk rating. If they don't encrypt your data in motion or at rest, those would be automatic elevated risk. If they don't have an incident response plan, if they don't have a security official, those are things that I would think I would highlight as high risk. Everything else I would say outside of that is going to depend upon the tolerance and the type of vendor. So I think I would never want to say there's only one set of risk determinations. I will tell you what I believe today. Certainly around, I'm going to add multi-factor authentication to that. I'm going to add, security continuous monitoring. If folks don't have the standard blocking and tackling, it's going to be very, very difficult to say that they wouldn't be at risk in order to safeguard your information. And once again, I'm talking about a vendor that has your data, not a vendor that may be just accessing it from your resources, but you're literally giving your data to them, you're entrusting them, and I would expect that they would cover all of the best practices today as it comes to doing vulnerability scans, using multi-factor authentication, encrypting data at rest and in motion, having a security official, having a incident response plan. And if they didn't, those would be high risks. I would definitely recommend to you that those things would be high risk, that you would report to the business and make a determination, how to respond.
We had another question come in, and I'd actually like to pose this to the group, and hopefully, some of you may chime in, because I like to hear myself talk, but I think some of you may have thoughts and really helpful things to say about this one. How is your organization validating how the business associate or vendor is responding to certain individual rights? So we talked earlier about all the privacy rights that are included in privacy laws and rules, and curious to hear from you all. How are you handling? I know there's some privacy officers, some compliance officers on the call. How are you handling those instances where you're asking a business associate to fulfill certain individual rights requests? So think about organizations maybe like SIOX or others that are actually working with you to work directly with your patients or consumers. Anybody have any thoughts or advice? Okay. No thoughts. Well, if you do have thoughts about this, or you have things that best practices you can share, feel free to chime in later. Would be very interested to hear how your organization is continuing to manage different types of business associate relationships. Carrie, I can kick it back to you.
Okay, great. Well, we don't have any other questions. Is there anything, Dave and Andrew, that you wanted to address on the questions and topics?
Yeah, hi. Oh, hi, Christopher.
Hi, yeah, I just wanted to throw I'd actually just threw a question in right after it was said that we don't have any more questions. But I'd like to hear a little bit more about medical devices specifically. That's an area where we have, at least within my organization, we have some concern where we had some existing contracts, or we had some resistance from the vendor to provide, like timely cadence for patching, things of that nature. And I'd like to hear more about how organizations are managing some of that, based upon some of that resistance that those vendors are having. I don't want to use the term, but it's really the best term is, I think sometimes they hide behind the FDA certification.
Yep.
And then don't provide timely response to emerging threats. And not every organization has, micro segmentation. We have not invested in that yet, or things like that. So I'd like to hear more about that. We've talked a lot about risk in general, but I'd like to hear more about medical devices specifically.
No, thank you so much for that question, and I will say that I think you're right over the target, and bullseye into what I would say, generally speaking, most organizations are dealing with. Now, I'm going to answer the question generally for a moment as it relates to medical devices, and say where we have seen success, and where folks are having success. And this is, once again, and at a general perspective, is the relationship of IT and clinical engineering, the ability to understand the need in order to address medical device security. That need also comes with a mouthful of what does that really mean. A lot of it has to do with, do you have the ability to evaluate risk of that medical device prior to you either procuring that medical device or putting it on the wire? Not only from a security standpoint, but understanding, what ability do you have to harden the device? Can you change default settings? Can you apply security requirements that are adequate in order to say that that device is acceptable in order to operate on the wire? I think you hit the nail on the head when it comes to what are the strategies that organizations must be talking about and going down. Segmentation is key. That is a key strategy. Knowing what's on the wire, it's a key strategy. A lot of organizations are starting to utilize some tools and capabilities in order to guide them and assist them. I would say right now, what I find as the most valuable tool in the toolkit that is something that can be done with minimal impact and interaction with the vendors is, instead of going down a physical separation environment where you actually have to go through a large network infrastructure type segmentation, utilizing technologies that can manage at the application layer in order to help provide security policy around that, what that device can talk to, what it can communicate with, and apply that segmentation, using those managed devices. I think everyone is getting good at assessing risk. The challenge out there is being able to do something about it. The way that I see that being successful is, where did you get into the process? Where in the system development life cycle are you? The earlier you can get involved in that process, the higher level degree of success that you will have in order to putting that device in the most secure environment.
I don't know about anyone else, but we're late in the game on some of that.
Yep.
It's existing contracts, existing relationships, and then trying to influence that, after these have been in place for a long time.
Yeah.
What are some strategies that have worked to, I like the term of blast radius, right? If, let's say that, an X-ray device were to get compromised, a Windows-based X-ray device were to get compromised, how do I limit that blast radius? Well, first of all, it would be through segmentation. But, that's not something I can necessarily do today. But then, I guess maybe influencing some of the decision makers for what we're doing into the future as we're looking at implementing additional services from a particular provider, or new versions of the same thing, and that's why I'm kind of curious about what some different individual organizations are doing to combat some of that, or to push back on some of that, and maintain that supply chain and vendor risk management.
Yeah, no, it is the challenge of the day. And I think from what I will speak to, if I had a green field right now, right, and that green field was, hey Dave, come in and take a look at this problem, and you got the ability to implement what you want to implement. The first thing that I would want to be able to do is really make sure you have a good understanding of what is on the wire and what is connected, and even things that may not be on the wire. So there's two kind of parts to that. What's on the wire from a medical device perspective, what's not on the wire from a medical device perspective, and what are the risks associated with it? Because you can't do anything about risk or vulnerability or even come up with a plan unless you understand that. So I tell everyone, make sure you can identify. Then from there, it's all about building a program that allows you to address that. As part of building that program is making sure that you've got the roles and responsibilities, the relationships, the understanding. So when you can go implement remediation, how do you go about that as part of your organization? And that's no different than any other aspect to security and IT. It's about relationship. It's about your ability to go and understand, does everyone know their part and their place? Does everyone know what has to happen? That includes your vendors. And if the vendors are the ones that are putting roadblocks up, then what is the strategy to break that roadblock? And there's many different ways to do that. Some of it can be done contractually, some of it can be done, through embarrassment, as I like to say. I hate to say it that way, but there's many different tools and techniques that can be done in order to get a vendor's attention. I think you should hold all the cards in that case. A lot of times, the medical device community, it's not there yet. It's not mature enough yet.
Yeah, we usually don't hold all the cards. That's part of the problem.
Yeah. So what are the strategies so where you can start holding more cards? And part of that is knowing what you have, right? Knowing what the risks are, making sure you have a good program in place, and then working on communication strategy. I think communication strategy is key. You have to be able to say how can I communicate what the risks are to the vendor? How can I get to the vendor and the business? How can I get their attention? And what can I do? What can I do under my purview? And what do I have to do to ask the vendor in order to help with that patching process and that hardening process? The good news is I'm seeing more and more capability within your control. And a lot of that has to do with those types of technologies that identify, right? They do discovery, they identify risk. Then the types of technologies that not only identify, but allow you to apply security policy to those technologies. So you can segment without doing a network segmentation project. You can limit communication without doing a full bore, network type solution. So I think
we're seeing
tactics that are out there.
We're seeing that the vendors are playing ball a little bit more, but they're still, I think, worlds away from providing what we're really looking for as a covered entity and as a customer. Like I said, I still think they hide behind the FDA certification and say, well, it's an FDA certified medical device, and therefore we don't have to do this based upon these requirements. We do it on a much broader scale. and the one vendor I'm thinking of is based out of Japan. So they're looking, we just run into issues. So I was just curious about what others are doing in that space to hold those vendors accountable and not hamstring us and put us at risk.
Yeah.
Lower the blast radius like we talked about.
Go ahead, Brett.
Yeah, it's Christopher. So I manage our biomedical device security risk assessments group, and we're a huge organization now. We had two large organizations merge just a couple years ago, so we're one of the largest healthcare organizations, nonprofits in the country. And we decided to throw some of that weight around a little bit in our contract process. And yeah, that goes back to what Dave was saying, and it's earlier in the process. But when we now do pre-contract reviews of the MDS2 forms and their security posture, so that we can write into the contract, these things need to be fixed. I think we typically say within the next 2 years. And if they're not, we want a refund. And the vendor pushes back, but it creates a good dialogue with those sometimes where we have kind of all this money and power now to say, we're not going to buy it from you unless you agree to these terms and fix or remediate these issues over the next couple of years or a year or so. Again, our hope is that it will help not just for us, but to kind of change the industry, should change the expectations with these vendors. It is going to take some time because we can really only do it as new contracts come up, right? But I think as you look forward and you look at what contracts are coming up, you can try to resolve some of those issues within those contract relationships.
Thank you for that.
Dave, I have.
I was just going to say down real quick. This is a great discussion, and I'd be happy with any individual follow-up. Both Christopher and Brett, I'd be happy to do that at any given time after this. But appreciate the input very much so.
We have one more question come in. Can you comment on OT and SCADA devices or device security concerns and recommendations?
Oh, this is as I like to say, I would happen to believe this is like $1 million question that I think the only comment that I will make is that as more and more businesses rely upon the whole SCADA and OT environments within their organization, if you do a business impact analysis and determine that those systems, depending upon their criticality, you have to apply the same rigor from a risk, cybersecurity, hardening, and understanding perspective, and start to integrate those systems into your response plans, into your overall security continuous monitoring plans. And I think that's an area certainly where healthcare as an industry as a whole is not yet embraced completely. But I think it's an excellent point, and I think it's an area where, as you move forward, certainly based upon where those types of systems fall into your business impact. So what is the determination of the impact of those systems, and how important do they become in your overall business success and IT infrastructure and service delivery, that ultimately they have to be included in the construct of detection, in the construct of hardening, in the construct of alerting and responding in the same light. So excellent question. Look forward to, if you want to do any follow-up on that. That's actually a very, very good question for this discussion. Great.
We do not have any other questions, and I just want to take maybe one last minute and see if there's, while I chat, if you have any additional questions, you can put that into the chat or join us here in the video session. Is that next Wednesday is going to be a big day. We've got the annual report coming out. You'll probably all get that in your inbox, as well as we're going to be having our second session of the CTEK Summer Series with Caleb Barlow, our CEO, and Marty Arvin, our Executive Advisor on Privacy and Compliance, talking about incident response plans. So that will be one that you don't want to miss. So I want to thank everybody for your time. Again, this session is recorded. It'll be available at the end of the day here through the Adventure platform. If you would like to share this with any of your colleagues, feel free to forward them the registration link that you logged in with, and we'll go from there. So Dave and Andrew, any last words that you would like to share before we close up for the day?
I just want to take the opportunity to thank everyone for participating. This was a lot of fun for us. I'm glad that we can provide this information and interact, and look forward to any future dialogue with you. So thank you very much.
Yeah, agreed. Thanks, everybody.
Great. And just one last thing is a question did come in asking if we were going to be at HIMSS this year. We will be. There is a group of us going. We'll be in the Cybersecurity Command Center. We are scheduling appointments now. So if any of you on this call would like to schedule some time to meet up with us there, we've got some of our executives. Dave Bailey will be one, David Finn, Caleb Barlow, and some of our sales team will be there. So feel free to reach out to us and go to synergistic.com. We've got lots of resources, podcasts, videos, blogs, all types of different things that can help you with your security and privacy programs. So thanks all, and we'll see you next week.
Thank you very much.
Bye-bye.